Hi,
Hi,
Arti.
how are
So
you?
I'm good. I'm good. I was so super excited to be, hosting you that I logged in a little early.
Oh, thank you. And I've joined you early as well.
Oh,
Sorry.
Pramod is asking me, do you still continue your dental profession? Of course, I'm a full-time dentist, Pramod. I would not stop that for anything. Yeah, all right. So, hi, Arti. How have you been? I know it was a
I'm
long day
good.
for you.
Yeah, no, it's
Yeah,
okay. It's all right. How are you doing? It's
I'm
lovely
doing.
having, we haven't had a session for so long. It's lovely to
I
be
know.
doing this with
I
you.
know, true. And I was so excited to have you here, seriously. And because you've been such an important part of my endo journey. And, since the time we started doing our lives, you have been an integral part of the community, So your
Thank
support has
you.
always meant a lot to us. So welcome to Endo Strong, to the most amazing endo warrior, endo advocate I have ever met. So, so
No,
Aarti,
it goes
so
both ways,
Aarti,
darling. It goes
thank
both
you,
ways.
Aarti, thank you. So for people who haven't seen Aarti before, Aarti is a fierce endo advocate and an endo warrior. She has been suffering with endometriosis for more than 2 decades, which is a real long time. And she's a very active member of creating awareness about endometriosis in Kenya and also creates awareness online. So, Aarti, thank you so much for doing so much for the community. Thank you.
Thank you, Dr.
So,
Shilpa,
let's
and likewise. You do just
thank
as
you.
much. Despite, I've got to say, it's very commendable how advocates, despite what they go through in the end of journey, we still go ahead and advocate so that the next generation doesn't have to. And you're going through so much yourself. So thank you. Thank you for doing all that you do. You're amazing.
Thank you, and it's likewise. So let's just begin this session because I know this is going to run a little longer than usual. So, so because it's a very important topic that we are going to be talking about. So our topic for today's discussion is how to choose your doctor for when you have endometriosis, how to choose your surgeon. So, Aarti, first and foremost, before anything else, so tell me how long before your diagnosis with endometriosis were you suffering and how were you diagnosed?
So I was diagnosed with endometriosis in 2004 when I was 25 years old.
Hmm.
I was diagnosed through a laparoscopy. That's because I had to go into surgery for emergency because I had a cyst in my ovaries, which is the size my ovary was the size of a cricket ball. So and I was in
Okay.
excruciating pain, so I had to be rushed then. And I started my periods at the age of 13. So I'm assuming, well, 12. So it was a delay of 12 years.
Yeah, I can hear you. Go on. I was just spinning the topic so that people can see
Okay.
it. Yeah.
So yeah, it was a delay of 12 years. I'm 43 now. Well, soon to be 44. But yeah, so it's been a long journey.
Yeah. I mean, it's an extremely long journey and a tough one for sure. Very tough one. So, how does endo impact the lives of people it affects?
Should we say, how does it not affect or impact anybody with endometriosis? Because it impacts your life from every angle possible, from your education to your school. Like school obviously impacts on your education, social, personal, financial, mental health. It's literally, apart from it being a whole body disease, it's a whole lifestyle disease as well, you know?
Absolutely. Absolutely. So I know of a lot of people who are not able to take up a full-time job because of endometriosis and probably forget about job. For them, living a day-to-day life, a normal life is as difficult. What somebody can take it for granted is something like a blessing for people with endo if they're able to just function normally. I mean, I'm sure you agree with me on that.
Absolutely,
So,
absolutely. I keep saying, like, when you mention even things we take for granted, like I was telling my sister, after my excision in September, Like I just normal passing stool, you know. I'm not shy. I'm as transparent as I am. You know how I am. We lobby as
Correct.
much as we can and advocate through transparency. Just pooing without pain, simple task. So peeing for a lot of endo warriors have pain, you know, peeing. Things like that, being able to walk, being able to, okay, walking is still a challenge for many, but simple things like, you know, the bare necessities, it's such a struggle to do.
True, absolutely. So, knowing the number of struggles that an endo warrior has to go through, a person suffering with endo has to go through, how is it that we can support them?
So look, all, you know, we have the most common challenges, right, for endometriosis. It's, you know, it starts from the onset of delayed diagnosis, which is the biggest problem here. If doctors around the world can get the definition of endometriosis correct, which
Correct.
leads to the early diagnosis of endometriosis, then it's a whole life game changer for people with endometriosis. You know, and
Correct.
that is the
I
biggest
agree.
step. If we can, if somehow that narrative can change worldwide, oh, it will be so different. You know, because then it eliminates fertility issues, impact, which leads to impacts on relationships, which leads to, you know, again, education and work. Because the social, oh, sorry, my dog's gone
No
wild.
worries.
I apologize. I might mute
No
myself if she
problem.
goes completely bizarre. You know, sorry.
No
Um,
problem.
yeah, she agrees as well with what we're saying. So, you know, and then the work, as you said, you know, school, you miss school. You know, over here, we've had girls, especially in our slums in Kenya, you know, even in the rural
Hmm.
areas, like girls will dig up holes in on the ground and sit through the whole period um, span,
Oh,
you know, through the period cycle because they can't afford periods. And then that's again, I mean, period sanitary wear. That's again the other thing, you know, period poverty. So tapping into all of that, you know, making accessible products or making period pads accessible to all. Then there's a lack of awareness, a lack of support, menstrual health, all these factors. You see, if the delay of diagnosis was eliminated, all this would kind of wear off, no?
correct. Makes sense. Makes sense. Absolutely. So, what are the now, obviously, we know that the right definition to endometriosis is still not said. You know, that's the reason what happens is the treatment protocols towards endometriosis goes wrong most of the times because it is still considered as a endometrium, not endometrium-like tissue, and it is treated as endometrium. So, hence the delay in diagnosis, the delay in treatment, the delay in excision surgeries. So, what are the most important factors to consider when you're looking for an endometriosis surgeon?
Okay, so this one, this is very intense. You know, when you're looking for a gynecologist surgeon, you have to ask these certain questions. I did a whole post about it a few weeks ago. It's on the post
Yes,
is on my
I do.
page for those who want to dive into it more elaborately. It's, you know, start by use first of all, let's agree that not everyone can afford excision surgery due to the affordability and the accessibility of the surgeons, depending on where you are. You know,
Right.
um, it is a very expensive condition. It is a very expensive. I mean, over here in Kenya, for example, girls can't even afford the basic consultation charges. You know, so
I get that.
when you're looking for excision surgeon, let's move on from that whole if you can't get one. But if you can get one, then, you know, you ask them, start by searching who is the top endometriosis excision surgeon around in your area. How is the follow-up going to be? Because that's very important. You know, follow-up is very,
Correct.
very important after your excision. You know, ask them how often or how familiar they are with doing endometriosis excision. Speak to have your primary care on board, because it's very important that the two collaborate with each other, because your private care physician is going to be more available than your surgeon, because it's understandable, they're so busy. What are the surgeon's credentials? Read up on their board certification, read up on their training in endometriosis excision, how many have they done, read up on reviews from patients, because reviews really help, because we have a lot of excision doctors around the world that are just I'm trying to be a bit more cautious with my wording. We have a mixture. We have a seesaw of the good and the bad. Okay, let's put it as that, for better lack of words. And then you ask them, what is the success rate for endometriosis? What is the approach? Are you actually doing endometriosis excision, or you're just taking me in for ablation? The red flag is ablation. Anytime
Absolutely.
ablation is mentioned,
Right.
run. And the other thing is, the most important, which I think I should have mentioned in the start, is also how much the doctor takes time with you. An endometriosis patient, 99% is going to bawl out. They're going to
Correct.
cry, because they've never
True.
had somebody validate them until they see a doctor that does validate you. If the doctor wants to not continuously want to dismiss you and just put you on hormonal tablets because of the dismissal part, by them saying there's nothing wrong, run. That's a red flag. It's okay to have second opinions. It's okay to have third opinions, as long as you should feel that energy. You and your doctor should connect.
Correct. That's right. Also, what I've realized is that the primary physician and the excision surgeons most of the times don't work together, because the primary physician really feels that it is not necessary, you know, because of the lack of awareness, or I've got no clue why. And also, I want the audience to know there is a difference between ablation and excision. Excision is removal of the tissue completely. Ablation is just burning the surface of it. So an excision surgery is the gold standard when it comes to endometriosis surgeries. Endometriosis, I would not say cure. Endometriosis is not curable, but to treat it, to treat the person symptomatically and to prevent recurrence, excision is something which is the gold standard. So Arti, yes, one is gaslighting and ablation. Two, when you say the red flags, are there any other red flags that a person should look for when they go to a surgeon?
If you're told get pregnant, run. Okay? Pregnancy is not going to cure endometriosis on the simple fact, depending on how far the endometriosis is spread, what organs it has affected, and we all know infertility does lead to endometriosis does lead to infertility as well.
Right. That's right.
So you have other flags, like if just I'm just talking from my experience, especially when yes, I understand that certain surgeons do say that they want to put you on hormonal treatment to blow up the endometriosis before they treat it. But again, how does this impact? Because you have so many adverse side effects, that also impact endometriosis itself. So again, that's a red flag. And I always say that keep a journal, be educated yourself. So through listening to other advocates, what kind of red flags they are. In all honesty, Dr. Shilpa, I can't think of any more right now, because I don't know, I've probably got brain fog right now. Brain fog's another.
No, and for the audience, this session I'm doing with Arti just because she has undergone an excision surgery I think in December is when you went for your September. September is when you went for your surgery, and I'm sure you did a lot of research before you went for your surgery. So this is a first-hand thing that is coming from a patient who has gone through the process herself. So no one can be better than you when it comes to this. You know.
Oh, thank you. So, Dr. Shilpa, because you've tapped on that, let me tell you what I did, because it's very, you know how the newbies come and say, oh, we want quick fixes. There are no quick fixes for endometriosis. It's been a
Right.
very difficult journey. It's been a very isolating journey as well. After trials and you try something out, you do some trials, you test it out, and if it doesn't work, you move on. But you have to understand, you have to be very informed and educated about your own body, about the condition. Um, 10 years ago, I went all holistic. So because I was done with ablation surgeries, I was done with hormonal treatments, I just didn't want to know. And it's only in the recent years that excision has been voiced about so much. Everybody's so vocal about it in the last 5 years. And then COVID hit. So obviously that's when I got to know more of you and Dr. Vimmi. And it's true, following you guys, doing the research, following Dr. Vimmi's transparency of how she posts, that's how I decided to go to her. And again, I had three options. I could have gone to Dr. Sinervo in Atlanta. I could have gone to Dr. Cabrera in Mexico, or Dr. Vimmi in India. But for logistic purposes, India was the closest. Because then you have to,
Absolutely.
you have to put into all of that into consideration. And also, I did a lot of 8 months pre-surgery work, which is very important. Everyone focuses on excision surgery and post, but pre is as important. Like, for example, strengthening your pelvic floor muscles so that they can support the surgery, or strengthening any core muscles or your core itself to support your surgery is very, very important.
So pre-surgery is something which probably no one talks about, and I'm glad you touched upon it. And are there any particular questions which you had asked the doctor when you were planning on a surgery?
I'll be honest with you, because we've had that relationship with Dr. Vimmi and yourself for 3 years, I trusted her fully. I won't lie to you, my imaging was negative here, my imaging was negative there. I mean, yes, you could see a few things. And the radiologist, this is the other thing. Because I know my pain and I know my body, I said to the doctor, I'm telling you, if you go in, this is what's going to be. So you have to go in, regardless whether the imaging is negative or not. So that's the only thing I asked. I did ask about post-recovery because I have to travel back home. How long it will take. Again, even with surgery, as much as doctors guide you, there's no one size fits all, because everybody's body is different. Everybody reacts different. Everyone's response to recovery is different. But in all honesty, I didn't ask so many questions because I said to her, I actually burst out crying. I had to see a gastroenterologist as well, because I needed to do an endoscopy and a colonoscopy the day of my surgery. So I did that. And then after an hour and a half, I did an excision surgery. So even when I went to see the gastro, I just burst out crying in the office, because I was like, it's so nice to have a multidisciplinary team that believes in you.
True. Yeah.
Saying that, yes, you may have IBS, yes, you have all these other, before the colonoscopy came out, and they said that, yes, it's all tied together. So just finding a team that works cohesively, it's so validating, mentally especially.
Absolutely.
Absolutely. Like, I still tear up
Absolutely.
about it, because it was just, you relate to it, you've gone through all of this and more.
Yeah. Absolutely. But then there are right questions I mean, obviously with you, there was a trust which was there, obviously, because you knew Vimmi, and Vimmi obviously is very nice, no doubt about it. But saying that, there would be certain questions which I think the patients must ask the doctors. So would you want to touch upon that, Arti?
Yes. So again, ask them the familiarity of the subject itself, which is endometriosis. How familiar are they with it? How many complex surgeries have they done? And how many do they do weekly? then what is their success rate in treating endometriosis? Again, how do you treat the endometriosis? Is it again ablation or excision, right? Because that makes a huge difference. Then again, what is your approach to excision surgery in relation to endometriosis? Which leads to, again, if there's a complication, is who does do you work with a multidisciplinary team, and who do they consist of? Because in case there's a complication and you can't tackle it, how do I go about it? Do you give informed consent? Informed consent is a huge thing. Okay, you have to, every patient must have an informed consent, right? Then again, what are the potential risk times or complications regarding the surgery? Because you're better to have known than not known. Although this can also backfire on you, right? Because you can get hyper about it, thinking, oh no, what are these? And if you, by any chance, are allergic to any medication, like for example, I react to anesthesia really badly, it is very, very important that you tell your surgeon about it. So they know that post-surgery, they have to prepare certain medication for you to combat the side effects of the anesthesia. Okay, and the last question I think is very important is, what is the expected recovery time and the follow-up care? What consists of that follow-up care? Yes, every patient is different, but I'm sure there are guidelines to what care should look like for post-surgery.
Absolutely, because I think follow-ups and after surgery care are something, these are two things which are extremely important. As much as you may not think before going for a surgery how important it is, people who have gone through the surgeries would vouch for it. It is extremely important, especially when it comes to endometriosis, because the surgeries are not simple surgeries for sure. They involve, God knows, I mean, a lot of organs. A lot of organs. So once the surgery is done, so how much time generally does it take for the recovery, approximately?
So it depends where you are and if you're traveling as well, right? Normally, I know I did a lot of research. I did speak to, I spoke to Katie from Endogirl's blog. I spoke to Heather. I spoke to Jambi from here, because they've all had excision, and this was my first. And I haven't had excision done before, and hence we can see Dr. Vim has joined us. Hi.
I'm so glad Vimi is there.
So then, so for me, again, I know it depends again how bad once a surgeon goes in there, recovery time depends on what they find as well inside. Like, for example, I traveled back on my 5th day post-surgery. I went to Dr. Vimi's office, and I actually sat there interviewing her for my podcast.
I know, I remember that.
Yeah, and I'll be honest with you, I did wish I stayed in India for a longer time just to recover, because I came back and I traveled on the 6th day. I had to obviously upgrade myself and I was on a lot of pain medicine. I came back, and recovery also got impacted with mum getting COVID 2 weeks post-surgery. So instead of resting for myself, I had to quarantine her and take over the household, which meant I developed a lot of scar tissue.
Right.
So that pain was really bad. And after that, we had a lot of deaths close deaths around. 2 months ago, I had a very bad accident, which impacted on the surgery area. So it set me back. So you see, you have a lot of, as much as recovery time we can give, it's very different, because it's also based on other lifestyle challenges that come about, let alone just recovery from endometriosis excision.
Correct. Obviously, there are a lot of other factors also which come into picture. And just when you said lifestyle, I wanted to get to the next question. So are there any lifestyle changes or any complementary therapies that can help you, with the post-surgery recovery and the outcome of the surgery?
So post-surgery, I've been very mindful and very careful to tap into it because, again, as I said to you, see, for me, I had to travel to India. I'm in Kenya. So in case something happens, or if there's if I take a complementary medication and I have to literally emergency see Dr. Vimy, how would I go about it? So I've been very mindful about that. It's only recently that I was also I went to see, I had to do a TVS because of the accident. And that's when I was told that I had adeno obviously in the uterus, right? And I wasn't aware about that. I literally wasn't aware. And so then I started the Chinese herbal medication. And this leads to, because for 10 years, I've been doing acupuncture, I've been doing Chinese herbal medication. It has really helped. It has really helped, especially. So now recovering, there's a multivitamin. I'm not promoting any medication. I'm not promoting any multivitamins, putting a disclaimer on that. But there's a vitamin that Dr. Vimy put me on. It's called Superdin. I never heard of
Yeah.
Superdin until I saw it. I didn't even research about it until I came back to Kenya, and I think it's incredible. Like, it's supported my recovery from inside, apart from everything else as well, holistically, it's been amazing. So I know that multivitamins will help, but you have to do it at the guidance of your doctor, your surgeon, and yourself. Holistic treatments, meditation, yoga. I've started doing primal flow movement, my yoga, exercise. I'm much better in even forms of strength now than I was before. I was getting better, but my ladder came down after the accident. So you can do all that helps.
I just hope that you feel better very, very soon. And I really hope that you feel your best. Actually, I mean, the accident I know has put you back in it has taken you back a couple of months, but I think you'll be fine now, and with your mental strength and your mental approach, the positivity that you have, it is going to take you a long way and the healing is going to happen really fast. And your positivity is something that you sprinkle on others also.
Thank you.
So,
It's tough.
so
You have
now
your days. You have your days. Like,
you have your days.
I did go through really bad overwhelm 3.5 weeks ago. And I just suddenly, I happened to have a friend of mine said to me, he said there's a friend of his who's got a coach who does burnout prevention. And I went to see him and I literally just I thought I will bawl out, but the day when I was going to see him, I bawled out. And then when we have the session, suddenly, you just, because of doing counseling, we have to do a lot of counseling, even post-surgery. Even pre-surgery, I did counseling to prepare my headspace for this surgery. Because mental health really gets affected. And if you don't know how to cater for your mental health and use the tools that you need to come out of a mental drown, then it's really difficult, And doing that session, he just reminded me of the tools that I already knew. So sometimes it's just a tap that you need to say, you know what, you've got it within you. So do it, it's okay. And it's okay to feel overwhelmed sometimes as well.
All of us go through that, and what matters is how well you bounce back. So that's what matters. We all have a good days and not so good days. I would not say the bad days. We do have our good and not so good days, and and we learn to get along with them also. So what can a person do to mentally prepare themselves for the surgery? Mentally and emotionally, probably both, because it's not easy to go for a endo surgery.
So I did a counseling session. I've gone to see my counselor, And I spoke to her and I said to her, it wasn't like literally a session because I've done counseling in terms of training as well. So I'm just in the
Mm,
process of getting my accreditation. And so we had a one-to-one, just telling her that I'm going for this, I'm okay with it. You need to accept it. You need to accept that you're going for endometriosis excision. It's going to be different. And acceptance in every journey of that road is very
mm,
important for your mental and emotional um, strength. And also I feel that, yes, if you can go with any family or friend support, it is great, you know, because that plays a huge role in just having somebody to lean on. But if you cannot, then don't forget you're your biggest cheerleader ever. You're your biggest strength. What lies within, the storms that you have battled as an individual, that's where the ray of sunshine comes from, from within.
absolutely. Absolutely. And I love that podcast of yours
Oh,
and the
thank
name.
you.
And the name. It is such a beautiful name, and the content is like so, so amazing. I mean, congratulations to you on having such a beautiful podcast. You
Thank
know.
you. Thank you.
So, Aarti, uh, it's sometimes gets a little difficult when a surgeon tells you certain things that you have to go through this, you have to go through this, you have to, the blah blah blah. So how does a patient advocate for themselves about choosing what they want and how they want, or how do they co-discover things with the surgeon?
A lot of research, which leads to education. I didn't say educating yourself because you have to do research to get educated, right? But the right education, the right research, doing it from the right advocates. We have far too many advocates who are one, pharma driven, two, push all these other side medicines, or get in touch with me and I'll cure your endometriosis because I have the miracle treatment. I mean, if you have the miracle treatment, you'd be a multi-billionaire by now because all the over 300
Absolutely.
million or 200 million people suffering from endometriosis will be your patients, right? So
True,
make
true.
sure you do your research in such a way that it's the right read. You have to read. You have to do the work. If you can't do the work, then don't expect miracles because miracles are possible in small doses. Even having 5 better days than supposed to 2 better days in a week is a miracle, especially living with
Absolutely.
endometriosis, right?
True,
So do your
true.
research, educate yourself, be an informed patient, write journals, write journals so that your journal can guide you in what to ask the doctor when you go. Write your questions down. So in case you forget to ask something, you have a notebook that says, okay, I needed to ask this. I've gone through this checklist. Here. This is how we go A, B, C, D. Because then that
Right,
helps.
right. So journaling has been very important. I mean, for a lot of reasons, because what happens is what I feel, Aarti, is when we go to the doctor, we are already so overwhelmed with the number of things which are happening that we tend to forget to tell a lot of things which have been happening, and then you get back home and you think about it. Oh, I forgot to tell this, I forgot to tell that. So when you make a journal, you exactly know, what symptoms are happening and what exactly you're feeling. And that's something which would help you as a patient and the surgeon as a doctor, to come to a conclusion about your surgery, right? So that's something very, very important. I'm so glad you said that, because this is something which I tell a lot of endo patients who call us, like they would be calling you. So to guide them, I think the first thing I tell them is please start making a journal, and start putting down your symptoms. And same goes with diet. There are n number of people. I think, I don't know, I should not be saying that, but I think there are so many people who who declare that they are the endo coaches, so-called endo coaches, and can treat the ailment with diet, with only exercise, only lifestyle modifications. I don't know, somehow it is misguiding, and there is no regulation to who can do it and who cannot do it. Every second person is an endo coach nowadays, because I think it's a booming market.
Absolutely, absolutely. It truly is. It's a joke. It's a joke.
Yeah, it
And
is. And
I was
seriously,
go on.
sorry, please go on. No, I said it actually freaks me out when somebody says that. Did you change your diet? Did you eat that? Did you do your yoga? Did you do like boss? I think people with endometriosis try everything. They try everything. You can't just tell them that have you tried this or have you tried that? And you
No,
can't claim things which are not possible.
no, not at all. And remember that it's a very personalized journey. So for somebody to say that, oh, yes, you can give advice that this is what I tried, this is what's worked for me,
Right, right,
try and
right.
yeah, try and do it for yourself and manipulate it to for it to work in your favor regarding how it responds to your body. And remember that these are not cures, these are just management
Correct.
modalities. you
Right,
know
right.
I did it all. I mean, I've had to eliminate you've seen my journey. The 10 years I went all holistic. At the end of the day, I still needed an excision. And I mean,
Right.
might even need another one. Who knows? Because of the progression of the illness, or it depends. You just don't know with endometriosis. Never say, "Oh, I'm healed, I'm cured, I'm done, I've done this," because that burden that you put on your head will result to very bad mental health challenges.
Absolutely. And also what happens is when you constrain yourself of a lot of things like not eating at all or eating certain food groups only, I think that is something which creates a lot of stress in your body at the end of it. So you have to see what works for you and what doesn't work for you. You have to, it's not something which will, I mean, something that will work for me may not work for you. So you have to be mindful about what you're doing and whom you're listening to and what exactly you're doing. So, Arti,
Before you go into the next question, I just want to tap on that is also remember we have food allergies as well. Food
yes,
allergies
that's right.
cause inflammation as well. So I didn't know about all of this until I did a skin prick allergy test in 2020, and I was allergic to so much, not only food produce, but even other things which I
Right.
had to eliminate. And then I saw a drastic change in the inflammation. So when these so-called endo diet coaches tell you stuff, it's very generalized, because I mean they probably have done what is that rollover machine where you do this bingo thing, right? Let's pick on one symptom. Let's pick on the next. Oh, bingo, here we go. We're coaches. So
Right.
yeah, no. Anyway.
Right. That's right. So, coming to my next question, how do you manage your mental and emotional health post-surgery? Pre-surgery, I understand counseling and all. Post-surgery, I think it does take a toll on your health. Mentally also, you're a little, obviously you've gone through something serious. So how do you cope up with it? What did you do to get yourself mentally and emotionally there?
I had no choice to get myself mentally or emotionally there because since
Hmm.
my excision, Dr. Shilpa, I've not had 5 minutes sit by myself with it. It gets me teary because it's a huge deal in my life. It was I literally don't want to get teary on the live. It was a big
So I know.
change. It was a big change, but because so many other things happen in life surround, I had to be strong to cater for everything external that I never had a minute to deal or sit with what I have gone through. You know?
I
So
get that.
yeah, so mentally it was very I just had to do it. I had no choice. I just had no choice. And yeah,
The
as you can
strong
see,
one.
like it does get emotional. Yes,
It
and
does.
you're like that.
It
Do
does.
we have a choice? Do we have a choice? We don't. And everyone says, oh, but you look fine. A lot of after surgery, I go, oh, you become healthy, you become this, you become that. And those comments also play on you because you're thinking, Like, look at what I've gone through after so many years of living with this freaking demon that's been inside of you. And now you've got an excision, you're still recovering from that. And then you have to deal with all these name callings that are thrown at you, not realizing. I just think, you know what? I came to a point where it's not about me, it's about you. It's not about me, it's about you. Your stuff, your mouth, your they don't gonna realize that. Change them.
That's true. I completely agree to what you're saying. It's not easy at all. Not easy at all. When you really don't have time for yourself and you yourself have to be the
For
strong
sure.
one.
Taking that side or your side.
So I don't know. I think I lost you.
Okay, I can hear you
Okay.
now. Yep.
Now I can hear you. No, I can hear you now. I think your screen froze. I don't know, maybe my network, you never know. So no, that's what I'm saying. So it's not easy. It's not easy at all. But one advice to anyone who's going through a surgery or who has just gone through a surgery, give yourself time to heal. Don't be in a rush. Don't be in a rush. People start thinking that, oh, I'm going through a surgery, I'll be like perfectly fine. And if you think that you will be 100% pain free after the surgery, there are times when you still have pain after surgery, so you'll have to be mentally prepared for that. You'll have to be mentally prepared for that. So maybe comparatively, you will be in a much better space, much better space, but obviously the recovery will take its own time, it will take its own course. Mentally, you will have to give yourself that kind of a space where you have to heal yourself mentally, emotionally, and physically, all three together, because there has been a lot of trauma that has been there for a very, very long time. So
Absolutely.
I don't know. It's actually a demon with which you're staying with. When I actually wrote that ebook, that's the reason I had that demon in that book's title, because that's what you feel when you have
Yes.
endometriosis, because it's invisible, it's inside you, no one can see it. You look healthy because it doesn't show on you, right? And your test reports come negative, your imaging comes negative, and everyone says that it's all fine, but you know that there is something wrong, and you just have to keep proving yourself all the time, so
Absolutely.
that's how
And
it
it's
is. That's
taxing.
how it is.
It's taxing like no one's business.
Yeah, I understand. I understand. But trust me, Arti, you have been fabulous, and thank you so very much for saying a yes for this session, because this really meant a lot to me and to a lot of other people who are watching this or who will watch a recording, of this session of ours. It's going to be like really helpful.
Oh,
So
thank you. No, and
thank
thank
you
you
to
for even having me.
no, no, I think we'll do another session very soon, and I know what we're going to talk about. I think we should do a session on recovery.
Definitely. From all aspects, right?
Just kidding. We have a lot of other topics that we would love to talk about. Aarti gets a lot of questions about everything about endometriosis. I do keep getting questions. So I think there are a lot of topics that we need to talk about. And I would like to thank all the audience who have joined us live. I don't see a lot of questions today. It's holiday season starting in India. So people are holidaying now. So we will get questions on the recorded session, and we will get back with the answers. Thank you so much, Arti, and to the audience, and we will be back soon. Thank you and have a lovely evening. Bye bye.